What about factors that might protect against dilated cardiomyopathy? So one of the questions people with inherited heart disease often ask is, what should I be doing with exercise? Is exercise good or bad for my heart? And part of the reason why this is a huge conundrum in the inherited cardiomyopathy space is that there have been data out there that exercise might actually exacerbate disease progression with more wear and tear on the heart and may trigger cardiac arrhythmias. And this needs to be balanced against the health benefits of exercise for everybody. And so we really kind of need to know whether exercise is safe and beneficial for heart health or whether it's going to have adverse effects. And it's an important point to consider that the impact of exercise on the heart may differ in people who've got normal hearts compared to people who have a genetic factor that affects their heart function. So this may affect the impact of the mechanical stress of exercise and the likelihood of arrhythmias. Next slide. So this has been a very, very controversial area, and we wrote a recent review in Circulation Research on this topic, just looking at recommendations for exercise in inherited cardiomyopathies. And it's really difficult to make broad brushstroke statements because the effects of exercise are going to differ according to what type of cardiomyopathy you have, whether it's dilated, hypertrophic, or restrictive, or arrhythmogenic. They are likely to be affected by the type of gene change, and different genes may have different effects. It depends on whether you've already got disease or not, and how severe that disease is, and whether you've already had evidence of arrhythmias. There's a whole lot of other patient-specific factors, such as what your general health and what medications you might be on. And there's factors like the frequency, the duration of exercise, how hard you exercise, and the type of exercise, whether you're a walker, a runner, or a swimmer, etc. So there's a lot of variables. So what do we know about exercise and truncating titin variants? There's not really much out there yet. So in the last couple of years, this has been a topic of interest. And there was one study by Savanito et al. Where they did ask people to look at their exercise habits over a retrospective period of about 6 years. And they found that people who exercise for more than 4 hours per week did not appear to have worse LV function or arrhythmias. Then there was another small clinical trial which looked at an 8-week bicycle training program in 13 patients, but actually only 6 of them finished the protocol. And in this study where they looked at cardiac function before and after the exercise program, it did appear that exercise improved fitness and LV function. And then more recently, there was a study in UK Biobank, again, a historical study, which suggested that moderate to vigorous activity was associated with lowered risk. And then in our recent study, we did find this trend to a later DCM onset with people who had moderate to high exercise. Now, the problem with this whole area is that there's no standard definition. And as you can just see from this slide, people define vigorous activity in all sorts of different ways. So we really don't have a lot of data, and we are hoping in the future to sort of get some more formal information. And what we need is clinical trial-based evidence for exercise effects, not only for safety, but also for efficacy, and so that we can make some recommendations. Next slide. But at the end of the day, it's very unlikely that one-size-fits-all exercise programs are going to be useful. And it's very unlikely that we'll be able to pick up a medical magazine and see recommendations for people with titin truncations are. And where the field is going is to really look at individualized exercise prescriptions that take into account all sorts of things that we've mentioned before, the type of genotype, what sort of heart problem that you've got, are you a male or female, how old are you, what is practical for your lifestyle. And all of these factors need to be taken into account. And so the ideal situation is when each person can have an individualized exercise prescription. And hopefully that is something that we'll be working for and aiming for in the future. Next slide. So just to summarize this part of the talk, we now are looking at the risk of dilated cardiomyopathy in a different way. In the past, we've really focused a lot on whether there was a titin truncation, yes or no, and that was the main thing that we thought was the determinant of dilated cardiomyopathy. But we now need to take a more holistic view of heart disease risk and look at each person and the sum total of risk factors in each person. So we're not just talking about the titin variant. We're talking about other factors in each person's genetic makeup that may promote cardiac disease or maybe that might protect cardiac disease. And then each individual person has a unique environment or combination of factors that may affect heart risk, including their age, sex, other heart conditions, other health conditions, medication, and lifestyle. And all of these factors all contribute to how the heart works uniquely in every person. Now, the good news about this is that you don't necessarily, if you've got a titin truncation, you don't necessarily need to just sit around and wait for dilated cardiomyopathy to occur. Now that we understand all of these factors that may be involved, it empowers people to be very proactive and to do what they can to reduce their risk of dilated cardiomyopathy. Now, it's very unlikely that you'll be able to eliminate the risk of dilated cardiomyopathy, but certainly if there's things that we can do to reduce exacerbating factors and work on those protective factors, then that's very exciting. And that's what the New Year message is all about, that we hope people will embrace this information and really look at their lifestyles and their heart health and see what can be done proactively for yourself and your family members. So what we're going to do now is to move on and to look at some of the practical management tips and some advice that might be helpful. So next slide. I'm going to ask Renee some questions first and see what she thinks about these answers. So Renee, I've just been diagnosed with a titin truncation, and my doctor told me that I have dilated cardiomyopathy, and I'm really upset about this. I've never had dilated cardiomyopathy before, and also my ECG is abnormal. What do I need to do?
That's a good question. It's one that we get quite often. So I guess current guidelines really limit this to having regular monitoring with your cardiologist and using standard medications to treat the cardiomyopathy and arrhythmia. And there's lots of different medications that are being used now. It might take a little bit of time to find the right ones, but they're generally the main things that most people are going to be doing. There may be some discussion about looking at maintaining a heart healthy lifestyle. And as we've seen from the talk so far today, hopefully really identifying and aggressively treating those other cardiovascular risk factors is likely to be important. And generally occurs, but I think now that we've seen that, this is a lot more important, and we can talk a little bit more in the next couple of slides by what exactly we mean by that. But certainly these are changing, mainly that regular monitoring. So keep seeing your cardiologist, keep going with medication. You might take a bit of time to find what's working for you, and then work on maintaining that heart healthy lifestyle and treating any other risk factors that occur.
Thanks. So the second scenario is I'm a family member. My mum's got dilated cardiomyopathy, but I've been told I have a titin truncation variant that I got from my mum. And the doctor said my heart's normal. What do I have to do?
We see lots of family members, and at the moment, really the only thing we can be recommending for them is regular screening and monitoring their lifestyle. Now, this is changing, and it is likely to change over the next few years. We may be able to do some pre-treatment once we've done some clinical trials to work out what works best. But at the moment, the main things that we would be asking people to do would be to have a regular echocardiogram and ECG to monitor your heart health. Now, the timing of that might depend. So we say anywhere between 1 to 5 years. And it often depends on what results you get back from your echocardiogram in particular. So if your heart has changed size, or if the pumping action, so the ejection fraction, has gone down a little bit compared to your last echo, then your cardiologist might want to see you in a year or maybe even 2 years. If everything is quite normal and you're very young, they might wait for 5 years. So it really depends on what kind of results you are getting. And then once again, our information suggests that identifying and treating those cardiovascular risk factors before you get dilated cardiomyopathy is really important, as well as maintaining a heart healthy lifestyle. And in general, these are information that's given to patients, but what we're able to do now is provide a little bit more specific information about risk factors for those family members. And so if we're looking at what do we mean by a heart healthy lifestyle and what recommendations would we be now adding to that regular screening and monitoring with the cardiologist for people who are affected, if we look at our general health, really what we're saying is monitor and treat for things like atrial fibrillation, for high blood pressure, for coronary artery disease, diabetes, thyroid disease, and chronic lung issues. So that might be things like sleep apnea, it might be things like chronic asthma or other respiratory diseases. And we're also suggesting people will have extra monitoring during and after pregnancy and chemotherapy, as Diane mentioned earlier, because we know that these can be risks for dilated cardiomyopathy. And if we can see that there are changes in someone's heart early, we've got a lot more options for treatment at the moment than we do if someone gets very ill. So certainly monitoring, treating these, particularly when you're young. So a lot of these are conditions that we all can have risk of as we get older, and we tend to be quite well monitored as we get into the later decades of our lives. But we really don't monitor younger people for a lot of these conditions, and that's certainly very important, as well as continuing to monitor and treat as we get older. And then if we think about lifestyle changes that we could all make to improve our health, that are particularly important for people with TTN-TV, so things like reducing your alcohol consumption, where you know that it's not realistic to suggest that everyone has zero alcohol. It would probably be the best for your heart, but people are likely to want to have a drink. We're saying don't drink to excess, and reduce that as much as possible. If you can make that zero, that's great. If you can't, then reducing that is better than doing nothing. Avoiding recreational drugs because they also have a toxic effect on the heart, and then maintaining regular exercise. So as we're young, we're often doing a lot and we're very active. As we get older, we do tend to lead less active lives, and a lot of us are sitting in front of our computers, which I do myself. So maintaining that regular exercise is important. As Diane said, that there's no good guidelines on how much and what to do at the moment, but certainly doing what you can is better than doing nothing. And then maintaining a healthy weight is important, as we've seen as well. So all of these things are little changes that people with a TTN-TV can work to make that reduces their risk, not only of dilated cardiomyopathy, but also of those other heart conditions that increase your risk as well. So I know that this space is changing quite quickly. And so, Diane, do you want to talk through some of the future research directions that are currently going on at the moment or are looking like coming in the near future?
Thanks, Renee. So this is a very exciting time in Titin-related research where we're really hoping to change the direction of our research. So based on our recent data identifying risk factors, we want to really get better at more precise risk prediction of when dilated cardiomyopathy may occur. And this is important for screening guidelines. And this is important for counselling family members, but also will be increasingly important as we work towards identifying and implementing disease prevention strategies. So if we really understand within a 5 or 10 year time frame who's likely to develop dilated cardiomyopathy, we can really sort of target these people and these age groups to preventative therapies. And we'd like to explore things like exercise and drug therapy for disease prevention. And there's probably people have heard of gene therapy in the titin truncation space. People are working on this. It's a bit of a crystal ball, and who knows how widely it's going to be implemented and if it'll be successful. But there are people trying to edit the genetic makeup to see if we can cut out the titin truncation from the genetic makeup. This sounds very futuristic, but it may be possible and is something that watch this space and who knows what will be happening in the future in this direction. So that's pretty much all we wanted to cover today. We'd like to point out some very important resources for people who want information. And I'd like to have a big shout out to Sarah and the whole Team Titin team who are doing a fantastic job to support families and promote information and education. And Sarah did all the groundwork for organising our webinar today. So thanks very much, Sarah. There are also patient support groups in Australia and in other places around the world for people who are interested.